Live about Pap smears. I get a lot of questions about Pap smears, what they are, who needs them, how often you need them. I'm going to be spilling all the tea on the top 5 things you need to know about Pap smears. I am so excited. Let me know where you guys are from. I am coming live from Inspire Primary Care in Las Vegas. Welcome, you guys. I get so many questions about Pap smears. We're going over the top 5 things to know about Pap smears. As always, if you have any questions, drop them in the chat. I will answer your questions as we go. And drop in the chat where you guys are from. What's up? Vegas is in the house. Perfect. All right, so Pap smears. First of all, the first thing to know about a Pap smear, you guys, is what a Pap smear is and what it is not. And what's up, H-Town? And so what a Pap smear is, ladies, is a cervical cancer screening. It is a test that screens for cervical cancer. What it is not the same thing as a pelvic exam. And a lot of women will think just because a doctor goes down with a speculum, and I am going to be showing you how a Pap smear is performed. Okay, just because they go down with a speculum and take a look at the vagina does not mean that you received a Pap smear. All right, and which is the cervical cancer screening test. So I will go over the difference. What's up? Marilyn's in the house too. And you want to know, okay, I will answer your questions about how often PAPs will be needed. That's one of the answers. So I see your question there, okay? And so, yes, a Pap smear is cervical cancer screening. A pelvic exam means a physician or a doctor just look down at the vagina as an inspection to see what's going on down there. Not the same as them actually taking the brush, sending it off for a pathologist to look at the cells under the microscope and let you know if those cervical cells are cancerous or non-cancerous, which is what a Pap smear is, okay? So hopefully that clarifies a Pap smear versus just a pelvic exam, all right? Okay, so very important, ladies, to know when your last Pap smear was completed, all right? So the number 2 thing to know about a Pap smear, we're going over the top 5. Drop in the chat where you're from. What's up, Doc? And I'm coming live from Las Vegas, all right? So the second thing I want to chat about is how a Pap smear is done. A lot of women have fear around the Pap smear and, it's this exam no one's really looking forward to. But let me tell you how it's done, okay? And I did 2 Pap smears today at Inspire Primary Care, and it is included in our membership for our Inspire Primary Care members. No charge for me to perform the Pap smear. And so let me show you what we do here. So basically, I get my ladies right behind me on our exam table. They are, bottoms are off. We have the stirrups, the footrests out, and then I comfortably lay them back, okay? I tell them to scoot to the end of the bed until their bottom is hanging off the bed. That will allow their cervix to kind of pop up towards me. Put my gloves on, put my light on, okay? So everything's lit up. And then this is called a speculum, you guys. And so basically, a lot of women will ask, why aren't you putting more gel? All right, we put just a little bit of gel or lubricating jelly, just a tiny bit, you guys, because actually a lot of gel obscures the Pap smear results and can make the Pap smear results come back inconclusive. And so you want to use just a little bit. So we put just a little bit for comfort, okay? Some doctors will not use any and will just run some water just to have it have more slip, okay? And so then once my patient is in position, we place the speculum, okay? We place it, we open it. And then we take a brush, a cervical brush. There are 2 different kinds you can use, but this is my favorite kind to use. This has a pointed tip so that the top part goes inside the cervix to collect endocervical cells. And then this flatter part collects the outside of the cervix. The cervix looks like this, like a donut. So it collects the cells from the outside, this wide part. And then basically, once I see the cervix with the speculum, I'm going to do, some people train on 3 spins. I like to do 10 spins because I want to make sure I get enough cervical cells so that I get the results. Okay, so then we spin the brush 3 to 5. I like to do 10 times. And then we have one of these handy dandy thin prep tests, okay? It's some fluid that we send off, and then we put the cells into the cup, all right? And then I remove the speculum, and then I have my patient sit up. I give her some tissues so she can wipe the gel and all that out, and then we're done, all right? Because this is a membership practice and I do everything on my own here at Inspire Primary Care, I then put this in my LabCorp bag, and I have a LabCorp box right outside my door, and then I put the specimen into the box, and I order the Pap smear order through LabCorp, and then they come. I put a little order into the computer and tell them come pick up the cells, and then they come and pick it up. The pathologist looks under the cells, under the microscope, tells me if they're normal or not, and then we have our Pap smear results. So that is how a Pap smear is performed, all right? So very important. That's what a Pap smear is. That's how it's done. Let me know if you guys have any question. I see you guys joining. Let me know where you're joining from. All right, number 3. The number 3 thing to know about Pap smears is when they should be done. Like what age should you start getting them done? And you should start getting Pap smears done at age 21. All right. And we do Pap smears from age 21 to 65. That is the age range in which we screen for cervical cancer with a Pap smear. Okay. And so people will ask me, what if you're not sexually active? Again, if you're 21 and you're not sexually active, this is not screening for sexually transmitted infections. This is screening for cervical cancer. So just because you're not sexually active, yes, you should still be getting your Pap smear if you're over 21 years old. All right, the number 4 thing to know about Pap smear, you guys, is how often they are done. You guys, this one right here, I had to take a sip of water for this one because this one is confusing, and I understand why patients are confused because the guidelines are confusing. But most of my patients think that they need a Pap smear every single year, and most of the time that is not the case. So let me share what the actual guidelines are on how often to get a Pap. If you are between the ages of 21 to 29, you should be getting a Pap smear every 3 years if your Pap smear results are normal. So you get a Pap, it's a normal result, you're between the ages of 21 and 29, your next Pap smear should be in 3 years, all right? If you are over 30 years old, so you're between the ages of 30 and 65, and you got a normal Pap, your next Pap smear should be in 5 years, okay? And over the age of 30, we do the Pap smear in combination with the HPV testing, human papillomavirus testing. So if you're between the ages of 30 and 65 and your Pap smear was completely normal, your next Pap smear will be in 5 years. Many women just think that it's supposed to be every year, and that's just not the case unless you have an abnormal result. Now, if you have an abnormal result, it depends on what abnormal result comes back, because there are lots of stages of abnormalities in cervical cells. And depending on what stage of abnormality your cells were at, that will vary on how soon your next Pap smear should be done. So there's totally some abnormalities where the recommendation will be to get your Pap smear done the next year. However, if your Pap smear was normal between ages 21 to 29, you do it every 3 years. And if your Pap smear is normal between the ages of 30 and 65, you do it every 5 years. I know it's complicated, but guess what? That's why you're supposed to have a primary doctor. That's why you're supposed to have a doctor who knows the guidelines, so we can help you stay up to date and help you to appropriately get screened in the right time frame. If you're in Las Vegas, you already know you should be a member of Inspire Primary Care, because I help keep all of my members up to date on their health screenings, including their Pap smears, okay? And then the number 5 thing that I want you guys to know about Pap smear is who does them, because this is a question I get all the time. You guys, I'm a board certified family medicine physician. I practice with an emphasis on lifestyle and preventive medicine, but yes, I do Pap smears. And so what kind of doctors do Pap smears? Family medicine or primary care doctors do Pap smears, typically family medicine, okay? Some internal medicine, a lot of internal medicine doctors don't do Pap smears, but family medicine doctors are trained in Pap smears, okay? So I do them. And then, of course, your OB-GYNs are going to do Pap smears as well. But a lot of questions I get, because this is a primary care practice and because we do a lot of things in family medicine, people wonder, do you do women's health? Do you do gynecology? I get that question a lot, and I do non-surgical gynecology. As long as you don't need surgery. If you need surgery, then I send you to my wonderful OB-GYN colleagues that I partner with and that I refer to. However, if it's surgical, gynecological healthcare, you have a vaginal discharge, you have you need your Pap smear, etc., then yes, we do that here at Inspire Primary Care. And the wonderful thing about it is it is included in your membership. So when you go to a traditional insurance-based family medicine office, you typically will see two different charges. You'll typically see a charge from the office for the doctor to perform the Pap smear, and then you typically will see a second charge from the lab for the pathologist to look at those cells under the microscope. So for me to perform the Pap smear in the office is included within your membership, which is a huge cost savings to my members. And I have gone to the local labs, pre-negotiated discounted cash rates. So I have fabulous cash ratings at the labs for the pathologist to look at the cells. Okay, that's the wonderful thing about Inspire Primary Care. I go to local places and pre-negotiate cash rates for my patients. I've done that with colonoscopies, discounted cash rates on those. I've done that with imaging center, discounted cash rates on those. And most of my rates beat insurance rates. And so it allows my cash patients to have affordable rates on these important health screenings. And it allows my patients with insurance to price check and see what's more affordable, to use their insurance or to use my cash rates. I'm just saying, Inspire Primary Care is amazing. It's amazing. I am committed to providing the best primary care experience in Las Vegas. And that's a big statement, and I'm committed to that. And so if you are in the Las Vegas area and you've been wondering about where quality primary care is, what a membership medical practice is, and if that's the right fit for your healthcare, it's open enrollment season. You don't want to go another year with having poor healthcare. Primary care is the key to prevention and reversal of chronic disease, and the key to having your health on point. So you guys don't want to go another year with your primary care aspects being up in the air. You want to have a good quality primary care doctor, one that's passionate about your health and wellness, and that's what we are all about at Inspire Primary Care. So if you have any other questions, drop it in the chat. Let me know what other questions you have about primary care, about entrepreneurship and business. You know, this is our 9th month of Inspire Primary Care, and I love sharing what I've learned about entrepreneurship along the way. I love sharing about health, wellness, and primary care. So any questions you guys have, I will create content around it, and I'll come live and share what you guys want to know about. So I hope this was helpful about Pap smears tonight and the things to know about Pap smears, because I get a lot of questions about it. So if you're in the Las Vegas area, inspireprimarycare.com, we are still enrolling members. And you guys, we are only accepting 350 members. I know if you've been following the journey, when we first opened, we said we were going to accept 600 members. But now that we are open, and because I am committed to that VIP concierge style care, where my patients feel like a VIP every time they reach out to me, I had to decrease the number of patients that I will take, or members that I will take to the practice, so that they will not feel like, oh, it's gotten so big that I don't get that personalized attention anymore. So once my patient panel has 350 members, my practice will be full. Period. Point blank, period. And you do not want to wait until the practice is full, because at that point we will have a wait list, and I don't want you on the wait list. So we are currently accepting members at inspireprimarycare.com. It is the best healthcare experience in the Las Vegas Valley, because I'm committed to that. And I'm passionate about serving my patients. Let me know what questions you guys have. I will come back live and answer them. It is a pleasure to share about my love, joy, and passion for primary care. I'll see you guys next time. Bye. Hey family, tonight we are going live